This video is for patients with heart failure and their loved ones who are trying to decide whether to get a left ventricular assist device, or LVAD.
Hi, I'm Dr. Clyde Yancey. I am a heart failure doctor. I'm here at Northwestern University in Chicago. I'm here to help you with a very important decision. Someone has shared with you that you probably need something called an LVAD. And what is an LVAD? It's a left ventricular assist device. What we want to do is spend some time with you to help you understand what this is and how receiving an LVAD might or might not be the right decision for you, how it involves your significant others, your family members. But importantly, we're here to help you decide. Your heart doctor would like you to consider an LVAD because you have severe heart failure. Your current medicines are no longer working. Without a major heart surgery, you may die soon. You are in a tough spot. Many patients in your position have found this scary or confusing. These emotions are normal. This is a big decision. Therefore, before we tell you the medical facts about LVADs, we want you to think about your current feelings. Think about how would you want to live the rest of your life? Your hopes and fears, your biggest questions. There will be moments during the video that you're about to see that you may need to go backwards and listen to something again, or you may want to take notes, or you may have additional questions. But regardless, we are here to help you make an important decision. Not to make it for you, but to participate in the decision-making process with you.
What is an LVAD?
Hello, my name is Dr. Joseph Cleveland. I'm a heart surgeon at the University of Colorado. I'm the kind of doctor who performs the surgery to put in an LVAD, and I'm here to explain what an LVAD is. An LVAD is a machine that helps the heart do its job of pumping blood throughout the body. LVADs are used for different reasons. Sometimes an LVAD helps treat people until they can get a heart transplant. This means the LVAD is temporary. This is called Bridge to Transplant, or BTT LVAD. Other times, LVADs are used as permanent treatment for patients with heart failure who are getting worse but can't get a transplant. This means the patient will have an LVAD for the rest of his or her life. This is called destination therapy, or DT LVAD. Here are typical LVAD pumps. This gives you an idea of how big the pump can be inside your body. Now let's look at each part of the LVAD to better understand how the machine works.
Here is a person with severe heart failure. This is the heart, which is having a hard time pumping blood. The LVAD pump is attached to the heart during surgery and stays inside the chest. The device helps the heart to pump blood to other parts of the body. To keep the pump running, it has a cord connected to it. This cord holds important electrical wires and is called the drive line. It exits through the skin and connects to the controller outside the body. The controller operates the pump. It displays messages on the screen and sounds alarms. The LVAD controller must always be plugged into battery packs or an electrical wall outlet to keep it running.
Getting an LVAD requires major open heart surgery, where the pump is attached to the heart. The surgery can be dangerous and recovery can be difficult. Most patients stay in the hospital for at least a couple of weeks, and many need rehab services after. Patients with LVADs need a family member or friend to act as a caregiver during the first few months of recovery, and sometimes for longer.
What are my options?
Now that you've heard how an LVAD works, let's talk about your options. Basically, you have two options. Option one is to choose to get an LVAD. Option two is to choose not to get an LVAD. It's important to think about how you want to live the rest of your life and make a decision based on your values and life goals.
Option 1. Get an LVAD.
Some patients may choose the option of getting an LVAD. These patients' symptoms often improve, and they likely will live longer. However, they will experience major lifestyle changes for the rest of their lives. They may also experience some risk and side effects of the LVAD. For many people, though, it's worth the risk. Forreston and Cliff are two patients who decided to get the LVAD.
I took some time to think it over. I didn't want to, rush into anything. If I do get it done, I do stand a chance of living a little while longer. So I decided myself that I would do this.
Well, the decision, I sat down with my two daughters and my son in my room, and we talked, and the doctors told us that I was not eligible to get a heart because of the blockages in my legs and stuff. We just all sat and agreed that we would have it done and hope for the best.
Dale is someone who did well with the LVAD at first, but then experienced some complications. His LVAD was replaced after the first pump stopped working. He feels getting an LVAD was right for him at the time, but thinks about if he were to make the decision again today.
After the first one, I would say yes, by all means. I want to go on because I thought it was progressing pretty well. The second surgery was actually the undoing. If it happened now, I would decline simply because my body couldn't handle it.
Option 2. Decline an LVAD.
Other patients may choose the option to not get an LVAD. This means they accept their worsening heart failure and likely will not live as long. However, they will not have to go through surgery or deal with the major lifestyle changes or side effects of the LVAD. These patients are often ready to transition to care focused on symptom management and comfort. For some people, this is what they're ready for. Don is a patient who has decided the LVAD is not right for him. Here, he explains how and why he made this decision.
About 6 months ago, I made the final decision that I did not want to get an LVAD. It was a decision that was made over a period of months and made with the help of my spouse and siblings and friends and physicians. But when I decided I didn't want to go in that direction, there was a surprise from my family, my friends, and some of my physicians that I made that decision. And I think they were really just wanting to make sure that I thought through things clearly, because it's not the typical decision. People's first reaction is, I want to live. And I understand that. I want to live too, but I've been able to weigh other things, such as quality of life, and make the decision that was best for me.
Vicey is the wife of another patient who decided not to get an LVAD. She'll explain why the LVAD wasn't right for her husband.
The factors that went into our decision to not get the LVAD was that he did not want to be hooked up to a machine all the time. He did not want to have the stress. He did not want to have to go through major surgery, which we found out it was definitely major surgery. Did not want to have to worry about the infections that might come up afterwards, and just the healing process. I definitely think it was the right choice for him.
Life with or without an LVAD. How long might I live with or without an LVAD? Based on what we know from studies that followed patients for 1 year, patients are less likely to die if they have an LVAD.
With an LVAD, slightly less than 9 in 10 patients with advanced heart failure will still be alive after 1 year.
Some patients can live many years with an LVAD. Patients usually do not live as long without an LVAD. Among the sickest patients, less than 2 in 10 with advanced heart failure who do not get an LVAD will still be alive after 1 year. For less sick patients able to live at home, nearly 7 in 10 who do not get an LVAD will still be alive after 1 year. Most patients are somewhere between these two numbers. Ask your doctor about your condition.
These numbers are a summary from studies that follow patients for 1 year. But what will happen to each individual person is uncertain. No one can predict your future.
How might I feel with an LVAD?
After recovery from surgery, most patients with an LVAD feel big improvements in their heart failure symptoms. Many people develop less shortness of breath, less swelling, and more energy.
You know, before I got this put in, my life was being sick and getting up late in the morning, going to bed early, and now that I've got this in, I'm hardly ever home.
I anticipated a faster recovery, and I think he did too, but that hasn't happened, so we're learning to just go with what his body is able to do and accept it.
What problems might happen with an LVAD?
While LVADs can keep people with heart failure alive longer, there are risks. The first risk is the major surgery to attach the pump to the heart. For those who make it through the surgery, the average patient can expect to have about 2 hospitalizations per year.
Based on what we know from studies that followed patients for 1 year, some of these complications include the following. About 1 in 10 people with an LVAD have a stroke. About 2 in 10 patients develop a serious device infection. About 2 in 10 patients have a serious bleed that requires medical attention. Nearly 2 in 10 patients have ongoing heart failure.
Some people may also feel emotional stress related to their LVAD and may have a hard time adjusting to the thought of being hooked up to a machine.
What might happen if I do not get an LVAD?
Some patients choose not to get an LVAD. Most likely, these patients will not be alive after 1 year. After patients decide not to get an LVAD, they can continue taking their medicines as they've been doing. Often, their heart failure gets worse. They can switch to a care focused on comfort. Patients without an LVAD will not have to be dependent on a machine to live. They can usually leave the hospital earlier and spend their remaining time at home.
He did die within 6 months of when they told us he would, almost to the day of 6 months when they told us he would, but he died the way he wanted to. He died at home and he died very peacefully. He wasn't in pain a lot. He died the way he wanted to, and that's brought a lot of peace to me.
At this point in the progression of my disease, the focus has been more on managing symptoms and feeling better rather than prolonging the time that I'm here on Earth. And I wouldn't call it giving up. It's just management of symptoms is much more important now. I'm ready to accept death and get good quality of time as much as possible rather than add time to my life.
Changes and support for my caregiver and me. If I choose to get an LVAD, how will my life change?
Getting an LVAD requires many lifestyle changes to your daily routine. These are things you should consider when making your decision.
Power source. You must be plugged into a power source at all times. When you are sleeping, you will plug into an electrical outlet. During the day, you can switch to batteries and will be able to walk around freely. These batteries last up to 17 hours and then must be changed and recharged. Carrying equipment. Along with carrying battery packs on a belt or in a vest, you will also have to carry the controller. This equipment weighs about 3 to 7 pounds. It's important to also carry extra battery packs and an extra controller when you leave the house, in case anything needs to be changed.
Sometimes I still think, well, there's emergencies that could happen, and I try to always make sure that we have our emergency pack with us. And I feel like he needs to be responsible for it, but I need to be there to remind him just in case, so that we work together on making sure that we're covered.
Driveline care. The driveline site is where the electrical cord exits the skin. This must be managed very carefully. The bandages around the driveline site are changed and cleaned several times a week. If the site isn't cared for, it could lead to a serious infection.
Well, my driveline bandage I change after every shower. I take a shower every other day now. I don't get to take a shower every day, but I change it every other day, and it takes a process of about 10 minutes before you shower and 10 minutes after you shower to clean it and get dressed.
Water precautions. You must avoid going completely into water because of the LVAD equipment and driveline site. The equipment cannot be in water, which means you can no longer swim or bathe. In order to shower with your LVAD equipment, you must use a special water protection case. You also need to bandage your driveline site carefully. Other considerations. With an LVAD, you will have to take blood thinners for as long as you have it, which could be the rest of your life. You may also need to continue some medicine to help with your heart. Depending on your insurance coverage, you may have extra costs with your LVAD. You might have to pay for the bandages for your driveline and for follow-up medical visits. Some patients and their partners experience a change in their sex life with an LVAD, but for most patients, sex is safe after recovery from surgery. Patients may also find that they are no longer able to do certain tasks they once could. An LVAD is also a major decision for caregivers.
We've just discussed the changes that are likely to happen for the patient, but there's another party involved. It's the loved one. Let's talk about how loved ones might be affected by an LVAD. Now, caregivers are very important individuals. They're there with you before the surgery, during the surgery, and after the surgery. This caregiving usually decreases over time, but that's not always the case. Most hospital programs require that patients with LVADs have a highly committed caregiver every day for the first few months after surgery. The caregiver attends training to learn how to manage the LVAD. The training usually occurs in the hospital before and after the LVAD surgery. Once the patient is at home, the caregiver helps with several tasks.
The caregiver helps with driveline site bandage changes, checking for infection, battery care, equipment care and alarm response, managing medicines, arranging follow-up appointments, extra care during recovery, which usually lasts the first couple months after surgery. This could include sponge bathing, running errands, and driving the patient around.
Caring for an LVAD patient will require lifestyle changes for the caregiver. Most LVAD caregivers are happy to help their loved ones and are grateful they are still alive. However, some caregivers feel stressed with all of their responsibilities.
Try to be a little more sensitive to where he is. And just like anyone, when they become ill, it doesn't just happen overnight that you become a caregiver. You have to learn to be a caregiver. At least it has been for me. And because I've never had to do that in our married life before. We've always been both self-sufficient. And so that has been probably the biggest adjustment is to go at his pace and accept it.
Caregivers of patients who choose not to get an LVAD experience similar responsibilities and feelings.
But you've just got to realize you've got to take care of yourself also, because if you don't, then there's nobody there to take care of you both. So it's really hard on a caregiver to go through it, but it's definitely worth it in the end.
Some LVAD and hospice programs offer support for caregivers. Check with your local hospital to see what is available.
Services to help patients with or without LVADs.
Whether or not you get an LVAD, there are services to help you, either with your symptoms or ongoing heart failure if you choose not to get an LVAD, or with the care of the LVAD if you do go forward with that. The two services are palliative care and hospice.
Hi, I'm Dr. Jean Kuttner. I'm a palliative care doctor. The goal of palliative care is to help improve symptoms and quality of life. Palliative care helps relieve pain and suffering for people with serious illnesses, including people with and without LVADs. It also provides emotional and spiritual support to patients and family members. Hospice care is given by health professionals for patients near the end of their lives. This includes medical, emotional, and spiritual support. Hospice care usually occurs in a patient's home. It can also occur in other settings, such as a nursing home or a hospice center. When the time comes, hospice is available for patients with and without LVADs.
We talked about him going to the hospice center, but we found out that we could bring the hospital bed in, and we brought the hospital bed in the home. And just to know that there was someone that came in the house when I was at work a lot of times. I worked from home as much as I could, but when I wasn't working from home, I knew that the day they came, I could go to work and feel safe about it.
Here's the truth, whether we like it or not. Everybody eventually dies. That includes me, you, the doctors caring for you. This awareness, this acknowledgement is important because we all have the right to make a decision about how we want to spend the rest of our lives, a decision about how we want this chapter of our life to unfold. It is yours and yours alone to make that decision and to be certain that you're comfortable with that choice.
We don't want to die. The first reaction is, I'll do whatever it takes to live. And then coming to grips with the fact that we all die at some point, and quality of life has to be a consideration. And I knew overall not getting the LVAD would be the best decision for me, but there was also some resistance inside of me that said, you got to keep living, or maybe you'll get better. I think for some people there's that thought in the back of their mind that even when the odds are greatly against it, that they might get well or get better. And I knew that wasn't going to happen past a certain point.
How do I decide?
Let me first of all thank you for paying attention to this video. It's time to sum up. Let's summarize the two options. If you choose to get an LVAD, you truly do have a better chance of living longer. You may in fact feel a big improvement in heart failure symptoms, but there are risks involved, and there are important changes to your daily lifestyle. These changes will affect you and your caregiver. It's important to keep all of this in consideration. Now, if you choose not to get an LVAD, you won't have to go through major surgery. You won't be dependent on a machine to live, and you won't have to worry about the risk of the LVAD or the lifestyle changes that go along with this. But remember, you likely will not live as long. It is our hope that by thinking about these options, these trade-offs, you can begin to decide whether or not an LVAD is the right choice for you. This really should be a very personal decision based on your values, your wishes, and what's important to you, and it should be a decision made with your caregivers. Before you make a decision of this magnitude, make certain all of your questions are answered. As I said before, this may be a scary time for you and for your loved ones. Take the time to consider what you now know about LVADs and make the decision that is right for you.